Buenos dias! From Region 9, from the western part of Mindanao. We are 55 strong members as far as from Jolo, Zamboanga City, Pagadian, and Dipolo. We are very happy to present to you our infomercial, Sweet and Safe.
Are you pregnant and more than 25 years old? Are you pregnant and overweight? Are you pregnant and have a family history of diabetes? Are you pregnant and have given birth to an excessively large baby in the past? Are you pregnant and not physically active? Are you pregnant and any of this? If you are like any of these 5 women, then you are at risk for gestational diabetes mellitus.
Can develop gestational diabetes during pregnancy. Some women are at greater risk of having it because of some factors.
Women with the following are likely to develop gestational diabetes: being overweight, not physically active, family history of diabetes, has given birth before to an infant more than 9 pounds, women more than 25 years old, is pre-diabetic, has had gestational diabetes before, has had polycystic ovary syndrome. Filipinas and other Southeast Asian women are known to be more likely to have it than women from other races.
Most of the time, gestational diabetes doesn't cause noticeable signs or symptoms. Increased thirst and more frequent urination are possible symptoms.
Women should seek healthy care early. Even when you are still planning to become pregnant, you can already be assessed if you are at risk for developing gestational diabetes mellitus. And your doctor can already help you prepare yourself. Your doctor will assess your risk for gestational diabetes during your first prenatal visit with a blood test. Women who are likely to develop gestational diabetes are often asked to do the glucose challenge test. You do not need to fast for this. If you fail the test, you will have an oral glucose tolerance test. You will fast for a certain period beforehand. These tests are done again at 24 to 28 weeks pregnancy. Women not at high risk are asked to do this when they are at 24 to 28 weeks pregnant. Gestational diabetes mellitus is a type of diabetes among pregnant women who were not diabetic before they became pregnant. Gestational diabetes mellitus leads to a complicated pregnancy and puts the health of both mother and child at risk. According to the Department of Health, 1 out of 7 pregnant Filipina suffer from complications of gestational diabetes.
It is not yet known why some women develop GDM while some women don't. However, overweight women before pregnancy seems to be at higher risk.
The exact cause of GDM is also not known, but there are theories. When a woman is 4 to 5 months pregnant, her placenta produces hormones that make her cells resist insulin. The effect is that cells do not absorb as much sugar from the blood causing blood sugar to rise, otherwise known as diabetes. The more the placenta grows, the more of these hormones are produced, causing the level of sugar in your blood to go up and thus causing even greater complications for you and for the baby.
Gestational diabetes that's poorly managed can cause a long list of problems for the pregnant woman and her baby.
Gestational diabetes mellitus can lead to the many complications for the mother, such as hypertension and preeclampsia, that causes high blood pressure and other symptoms that can threaten both mother and child.
Early detection gives mothers the best chance of managing GDM well. Treatment for gestational diabetes focuses on keeping blood glucose levels in the normal range. Maintaining a healthy lifestyle is the best way to manage gestational diabetes.
Most women with gestational diabetes have healthy pregnancies and healthy babies. Getting good treatment makes all the difference. A pregnant woman with gestational diabetes can do these things to avoid complications. Eat healthy. Exercise such as walking and swimming. Continue eating healthy and exercising after you give birth. Go to your prenatal appointment regularly. Test your blood sugar. Take prescribed medication. Avoid gaining too much weight. Closely monitor your own health and alert your doctor right away for anything unusual.
The high levels of sugars in the blood of the mothers with gestational diabetes could put the baby or the fetus at risk.
The baby absorbs excessive amounts of sugar from the mother's blood and stores them as fat, causing the fetus to gain weight excessively. This is called macrosomia. Sometimes, early delivery is ordered by the doctor because the baby has grown so large.
Ang laki ni baby. Masicesarean ka talaga nito.
Kawawa naman ang baby ko. Ikaw na bahala.
There are no guarantees when it comes to preventing gestational diabetes. But the more healthy habits you can adopt before pregnancy, the better. If you've had gestational diabetes, these healthy choices may also reduce your risk of having it again in the future pregnancies or developing type 2 diabetes in the future. Eat healthy foods, keep active, start pregnancy at a healthy weight. Don't gain more weight than recommended. In addition, women with diagnosed GDM should be screened for persistent diabetes at least 6 to 12 weeks postpartum. It is also recommended that women with a history of GDM undergo lifelong screening for the development of diabetes or pre-diabetes at least every 3 years.
Although gestational diabetes mellitus is potentially dangerous to the health of both mother and child, with the proper management by both doctor and mother, it can be overcome, and the experience of pregnancy and delivery can remain a beautiful one.
I hope you enjoyed our infomercial on gestational diabetes mellitus, sweet and safe. Thank you everyone. Buenos dias.